So share a little bit more about ICA's work in general, becoming this natural leader in this space.
Yeah, so ICA Group is really an amazing organization. I feel so lucky to work here. So now our mission is to advance businesses and institutions that center worker voice, grow worker wealth, and build worker power. And that really underpins everything that we do. We do primarily focus our efforts on growing and expanding worker ownership.
And it's true when people feel respected and heard, it's actually a power boost. It's amazing how it transforms and opens up, and then all of a sudden you got this potential that can just move mountains.
I think, thinking about home care, there's so much work to do. Home care jobs are not good jobs yet, even in the cooperative space, but just the pure fact of being respected and being cared for and being seen is really a monumental shift.
Welcome to the Co-op Nation Network, where we're celebrating cooperation in action and spotlighting the innovators, reimagining business through shared ownership, shared purpose. And I'm your host, Aja Simons. And today we're diving into the powerful world of cooperatives with one of the Co-op Nation's leading experts, Katrina Kazda, Vice President of Home Care Innovations for the ICA Group. Founded in 1977, nationally recognized leading expert in employee ownership, worker ownership, and so much more. ICA has been pioneering models that help small businesses thrive by pooling resources, reducing costs, and building collective strength. As we prepare to launch our own shared services cooperative in Athens, Georgia, we're learning from those who have paved the way, and ICA's work offers incredible insight into how share ownership models can transform industries and empower communities. So stay tuned as we explore and get started. We're going to welcome Katrina to the program. How are you today, Katrina?
Hi.
Welcome to
Good
Co-op Nation.
morning. Thank you. Excited to be here.
Thanks so much for being with us. Excited to learn more about the amazing work y'all are doing. I know a little bit, but there's so much more to delve into, and hopefully we can get to a lot of it today. So share with folks before we get started a little bit about Katrina Kazda, how you became involved in this work.
Oh, wow. Well, it was a little bit of a winding journey as as these things typically are. So I joined the ICA group in January of 2017. So I have been here for almost 8 years now. And it's been amazing. In advance of joining ICA, I actually was not involved in the cooperative space, though it was, sort of in my ecosystem, I would say. So before coming here, I was working on environmental sustainability, both at a national level and at a local level. So immediately prior, I was working with an organization called Sustainable America, which was working on food and fuel sustainability nationally. In advance of that, I was working at the Sustainable Business Network of Massachusetts, where we were really working to strengthen local economies and also local environmental sustainability. And prior to that, I really was working internationally on international sustainable development, which is what I studied in graduate school. And was focused there on also environmental sustainability and on women's empowerment and women's education with a focus on Asia. So kind of a winding pathway, but as I look back, there were a lot of connections and links to what I do now. And really how I came to the cooperative movement was ultimately frustration. Working in the environmental sustainability field, part of my job, and in particular my last job, was focused on helping companies become more environmentally sustainable. And, I was working at some really well-resourced companies in Connecticut, and just feeling incredibly frustrated that these places that just had ample resources were not even recycling paper, things that were really basic. In this day and age, it just didn't make any sense. It's not that people were not educated or that they couldn't afford, the different, recycling systems or whatever. And that's just one small example. And it really became apparent to me that meaningful environmental change was not going to happen unless we shifted power structures and, sort of the flow of money in society. So that was really it's sort of an odd story of coming to cooperatives. I'd always, had food cooperatives and things like that in my life, so I was aware of it. But it was really that kind of lived experience of just realizing that meaningful change would not happen unless we really change the systems that kind of underpin everything in our
Mm.
society. And so right at that time that was kind of having this dawning and frustration, I happened to move to Northampton, Massachusetts, and the headquarters of the ICA Group was moving to Northampton at that time as well. And so in my job search, I came across the organization and I just was really instantly intrigued. I thought, okay, maybe this is the right thing for me. And I have absolutely loved working here and working on worker ownership and expansion of the worker cooperative model. I really deeply believe in it as a tool for that deep systems change that we need.
Wow, what a beautiful story. Yeah, I always love to hear the stories of how we come into it. They're always so different, but that's really beautiful and how it just sort of naturally evolved. So definitely you're supposed to be where you are right now. So share a little bit more about ICA's work in general, becoming this natural leader in this space, about the worker cooperatives, and then how you're integrating this sort of shared services theory of change into the work.
Yeah, so ICA Group is really an amazing organization. I feel so lucky to work here. It was founded in 1977. ICA's early history actually came out of kind of a counter movement against globalization. So when factories and sort of small industry was starting to move abroad to other countries, the organization was founded to really utilize worker ownership as a model to try to keep those jobs and small scale manufacturing and industry in the United States. So that's actually where we came from. And the ICA Group stands for the Industrial Cooperative Association, which is something that we don't talk about much now because it's so different than what we focus on now. But that was our early history.
Okay.
And so now our mission is to advance businesses and institutions that center worker voice, grow worker wealth, and build worker power. And that really underpins everything that we do. We do primarily focus our efforts on growing and expanding worker ownership. So we are, supportive of all cooperative models, but we are really specifically focused on worker ownership because we believe it is the most powerful tool to really building power, through democratic workplaces where owners really have that meaningful ownership over their work and a say and voice in the way that, their work is carried out. And so, I talked about that early history of ICA, but for the last 10 plus years, probably about 15 years now, ICA made a strategic shift into focusing more on service industries and low wage industries, and really thinking about, how can we utilize the worker ownership model to push for transformation, actually, of different industries and systems. So, for example, my work is focused specifically on home care, and we have a dedicated home care program. We also have a child care program. We have an alternative staffing alliance and an alternative staffing program. And then we do also have a program that's called New Ownership Opportunities, which is really focused on bringing worker ownership to more communities and really raising awareness of the worker ownership model, and in particular, making sure that worker ownership and access to supports around worker ownership development is extending to BIPOC and low-income communities, places that maybe are not typically as exposed to the model sort of through the current cooperative ecosystem. And so in terms of secondary cooperatives and networks and kind of how that folds into our work, so ICA's theory of change is really kind of multi-layered. So, our kind of at the baseline, our goal is to grow and support worker-owned companies, kind of a firm level approach. And making sure that worker-owned companies that are launched are the strongest that they can possibly be. They're operating well, they're financially sustainable, they're good companies, that are going to really stand the test of time. But we also know that individual firms alone, both are going to struggle often, in particular in low-wage industries, like home care. It's just very, very difficult to run a home care business, period. And then a home care cooperative sort of adds layers of challenge because there's not a lot of margin. And so any additional money that you're putting towards wages and trainings and things like that also erode money from marketing and other things that a lot of other companies in kind of the traditional space spend money on. So that's a challenge. And so by pooling businesses together, firms together, you can actually pool resources, and be more effective and kind of better compete with chains and national franchises and things like that. So that's kind of part of that strategy. And the other is that individual firms alone are not going to transform systems. So there are so many amazing cooperatives that are out there. Many of them are very active in policy advocacy or just advocating, for change in their sector. But one group of individuals alone is not typically going to transform an entire system, especially if it's something, that's been entrenched for hundreds of years. So really it's kind of this other layer of really pooling voices. So pooling resources, financial, intellectual, but then also pooling political power, to be able to advocate for change. And the larger those networks are, and the more cooperatives that are a part of it, and the more empowered the individuals within that network are to speak up and to speak out, the more power we have to actually impact the larger systems change that we want to see through utilization of the cooperative model. So it's kind of that multi-layered approach.
Mhm. I love how you laid that out. Yeah, there's definitely layers. I was talking to or doing presentations on marketing the other day, and it was really, I couldn't believe there were so many layers when you actually break it down. You have the internal communication, you have the external communication, you have like this sort of more expansive communication to the community, you have your staff, your board, you're like all these different layers. You have
Many
promotional,
layers.
educational, marketing, like all these different things. So I love how you layered that for us as well. That's definitely a big part of being in a cooperative or having to support a cooperative, understanding all those different layers that are happening simultaneously. So share with us a little bit then about maybe some examples on the worker cooperative side, and then also on some of the newer shared services cooperatives that you all are putting together, or just in general. I know also your home care. So in any order that you'd like to share, just some of the examples of how these models are showing up and how you're nurturing them through ICA.
Yeah. Yeah, so definitely my purview is home care. So it's easiest for me to share examples from that, though I can certainly touch on others. Um, in the home care cooperative space specifically, there are now 25 worker-owned home care companies across the country in 10 different states. There's another dozen or so that are being developed right now, so we're seeing a lot of growth. And the first worker-owned home care cooperative was Cooperative Home Care Associates, which so many people are familiar with. They launched in 1985, and they are still one of the largest worker-owned companies in the U.S. in any industry, including in home care. And gosh, the worker-owned companies, the home care cooperatives that we work with are just the most amazing companies. That's why I'm still in this work, because I just love the people that we work with so much. And I think there are so many examples of how worker ownership really meaningfully impacts people's lives at such a deep level. So one of the examples, cooperatives that I love to share about is Home Care Associates in Philadelphia. So they were actually launched as a replication effort coming out of Cooperative Home Care Associates. There were actually a number that were created, sort of replicating off of that model. Unfortunately, many of them closed in the early 2000s because of Medicare reform. So a lot of them were actually initially servicing clients that were receiving Medicare. And then there was a large policy change that decided that Medicare would no longer pay for home care services. And so a number of those companies ended up folding. It's a lesson that we have, have learned from, that actually companies really need to be diversified in their revenue. So just a little
Yes.
side note there.
Yes.
But, Home Care Associates was launched in the early 90s, and they are such an amazing company. They're primarily, employed by and owned by Black and brown women in Philadelphia, and their leadership team is primarily women of color. And there's so many individuals there who tell these incredible stories of really coming into Home Care Associates and being reliant on public benefits, and being a little unsure about their life trajectory, coming to Home Care Associates for a job, but then very quickly learning this was not just a job. They were actual owners and having a say in the company, and being invited to participate in committees and to join as members, and then finding themselves on the board or as a part of a committee, and then maybe in the leadership. There are multiple examples of individuals who started as caregivers and now are leaders in the company and training new caregiver owners who are coming in. And then, through that ownership and sharing in the profits, being able to actually, buy a house, say, and support their family in improving their conditions. So it's just amazing to see. And I think there are so many examples of that, of individuals who came from, the larger home care industry, where they're really just treated like kind of replaceable commodities. It's just come in,
Yes.
come out. You don't like the work. Well, too bad. You don't like the
Right.
wages, move on. And things are changing now, thankfully, though very minimally.
Slowly.
Yeah, very slowly. There's a lot to do, and things are rolling back at the same time. So it's a really, really tough industry. But just for them to then come into a home care cooperative and realize actually someone cares about their voice, that they have expertise to offer, that they are a valuable part of that business and that community, and of making the company run well. It's just really amazing to see, that kind of that growth and that
Evolution.
Evolution,
Yeah.
exactly. So it's really pretty incredible. And I think, thinking about home care, there's so much work to do. Home care jobs are not good jobs yet. Even in the cooperative space, there's just so little money, and there's really large systemic problems that we're trying to address. But just the pure fact of being respected and being cared for and being seen is really a monumental shift for a lot of people. So it's pretty incredible. Yeah. And so just some really beautiful examples. And I think that plays out across worker-owned companies, right? That's the beauty of the model.
Agreed. And it's true, when people feel respected and heard, it's actually a power boost that I've seen happen. It's like this potential that was just there, sort of stuffed down. And then once it's just it's amazing how it transforms and opens up, and then all of a sudden you got this potential that can just move mountains. So I understand that. So talk about some of the other aspects that contribute to successful cooperatives through the work that you all have been doing and what you've seen over time, and also some of the things that maybe create more challenges. So some of those key factors that make a cooperative succeed or fail, or struggle. Let's put it that way. Over time, some of those key factors.
Yeah, I think it's so interesting. So there is this balance that has to be struck. So on the one hand, some of the most successful cooperatives that, that I experience and am aware of are those that really, really deeply lean into the cooperative model. Organizations that have open book management are really transparent and engaging their membership deeply in decision making and just informing them about the business and what needs to happen and engaging them in that growth. So I feel like that is so, so important. When that breaks down, that kind of transparency and communication and engagement, I do think cooperatives become weaker, because that's their superpower, right? Is the engagement, is all of
Yes.
the brilliant minds working together. So it's
Together.
so important, for that to be strong and for there to be active effort in maintaining and growing that piece. On the other hand, I have also seen many a cooperative that maybe are so focused on that they're not focused enough on the really kind of core business activities. So like marketing, right? It's really interesting. So we've recently started working with a lot more startups. And this is sort of my number one piece of advice to them is don't forget about marketing. It is wonderful that you're a cooperative.
Thank you
Right?
for that.
When you go out into the market, people don't know what that means and they may not care actually, right? And you are a business at the end of the day. And so again, in the case of home care, but it could be anything, right? You're providing a service or a product. And so like any other business, cooperative or not, you have to be able to communicate how you're different. What is the value that you're delivering? Why should a customer choose you? And I think that often gets left off. And very much the case also, focus on the financials. You have to really have a strong understanding of your financials. You have to really be very proactive in managing your business and understanding the flow of money in and the flow of money out, and really be super on top of that. And there's other aspects of that as well, right? But I think we can sometimes as cooperatives maybe focus too much on that engagement side and forget about this side, right? That we are also just businesses that are competing in the marketplace. And so we really have to, have ourselves, need to be up to snuff on that side as well. So it's really that balance is where people find success in really leveraging the strength and the power of the group and that transparency and marrying that with strong business practices. And that's really that happy place. And when one of those things is out of whack, then the companies tend to struggle a little bit more. So I think that's a big factor. Yeah. And then I think in general too, I've been thinking about this more and more. I was at Co-op Impact last week, and there was a lot of discussion about, in particular in this moment, how we all need to lean into cooperation even more. We actually don't cooperate enough, and there's so much room for growth there as well. Because, kind of referencing back to some of the earlier comments I made about sort of why firm and network, that applies, I think, broadly to the cooperative ecosystem, right? Companies can only be so strong kind of on their own. And in particular, in this economy and market where consolidation and big mega corporations, kind of rule the day, a very small company is going to struggle to compete against the resources that a company or companies have in that way. But how we can work against that is by deepening into cooperation and the cooperation among cooperatives and thinking about how we can achieve efficiencies of scale in a similar way while maintaining our values of cooperation and independence and voice and things like that. So
yeah, that's great. I love that. Yeah, definitely another balance. the P6 with our autonomy and independence, and but having those maybe infrastructural sort of norms together. Yeah, I think it's definitely key. I'm glad that came up at the conference. It's been coming up a little bit more and more over time, but I guess in these times, that's when cooperatives actually thrive, is in some of those times where there's great shifts and great changes changes and
Mhm.
or governmental changes and things of that nature as well. And so I guess that we're talking about the principles. So maybe P5 specifically, education and training information. Talk a little bit about your training programs and how you're able to sort of integrate that education. I know we're talking about how important it is to integrate that from the beginning now, especially collective decision making. Like, what is that? People have never seen that in many cases, or conflict transformation, those sorts of things, and then just the general principles and how to apply them and what it really looks like, and not just the principles, but the values, right? That kind of ground the principles. And so, talk about that magic that you have to sort of create to integrate that in, and where you can actually sit back and actually see that people get it, and that now they can sort of take that into the organization. I'd love to hear how you all approach that.
Yeah, gosh, education is so important and it's really difficult.
Yeah,
It is something that ICA spends a lot of time thinking about and investing energy into, and in so many different ways. Actually, at this particular moment, I think ICA is kind of deepening its investment in kind of what I would call ecosystem education. So really thinking about how we can transfer some of our knowledge and skills to other cooperative developers in the space. So our team, which focuses on primarily on conversions and company transfers, that's a key area of work for ICA that I didn't talk about, but we do have a team that does a lot of work on that, sort of agnostic to industry. And they are just developed and are launching and testing a program, really working on transferring those skills out to developers across the country, because we need more and more people doing this work, right, and doing it well.
yeah,
And we're thinking about something very similar in home care, because there aren't enough developers really versed in home care to get the sector to where it needs to be, which is really at a much larger scale. So thinking about how can we transfer knowledge and skills and provide support. So train the trainer is like an important approach that we're taking, because I do think education layers is layers is such a theme here. But you can do education at a national level. So we do webinars a lot. We speak on panels, we produce guides and things like that. But I think where education and training is most powerful is kind of maybe at two levels. One is really hands-on and in the community, right, with people, and really working through things kind of at a very tangible level. It's sort of one thing to present a big idea, right, and people might be inspired and absorb some of that information, but to really deeply learn something, you kind of have to engage with it. So that's part of why we're taking that train the trainer approach to some respect. It's kind of push information out into communities where people are working one-on-one or hands-on, with cooperatives. But then the other is really kind of what I would say is like deep engagement. So one of the ways that a number of our teams at ICA work, and this is very much true on the home care team, is that we will engage in kind of longer term consulting type arrangements where we're working with the company and we're looking weekly or biweekly at, say, like a metrics dashboard. We're really in the weeds of the business and not just saying, okay, here are the 5 metrics that you need to be looking at weekly, and here's a guide. Good luck. But like, okay, let us help you build the dashboard, which is also like a baseline for creating open book management, right? What are the numbers that you're tracking, and where and how are you pulling that information from? And when you put it in there, what is it saying? And then what do you do with that information? What are the strategies? What are the next steps? So really that deep engagement, and looking at the business and teaching via that framework, because I do think sometimes education can just be so theoretical, and then you learn something, you're like, wow, that's so great, and then you go back to doing your regular work, right? And
yes,
it's like, how do you actually implement that?
Exactly.
What's the next step? So that's the piece that we're really deeply invested in, and I think is most effective.
Mhm.
And so even when we're planning conferences, for example, the ICA Group plans the National Home Care Cooperative Conference. We've been planning the educational content for a number of years in partnership with the Cooperative Development Foundation, and now we're kind of taking over the full scope of the conference. But even there, where a conference is really more about, short-term, kind of presentations and things like that. But we're very much thinking about what is the tangible takeaway from this, and what can we do in the moment to really help people internalize the information. So maybe it's role playing, or let's actually create a dashboard, or let's ask a question and then pick it apart and do it live, so that people are really having that experience and then internalizing that tool, and ideally having a handout or something that they can bring back and share with their group, and move forward from there. So it's a long answer to your question, but I do think that's where the most meaningful kind of education and training is happening, is where it's that kind of that interaction, and that really deeply grounding it in like the day-to-day of the business, the lived reality, right, as opposed to only concept. And
Yeah.
introducing concepts is important too, but then what do you do with that?
Yeah, that makes sense, that would be a key factor. Yeah, and actually the application and the integration and trying it on, like sitting in it and
Mhm.
feeling it, like getting in the car, right, doing a test drive, to really sort of experience that and understand it on deeper levels. So that's amazing. Um, well, let's see. I know we've got about maybe 20 minutes left. We are speaking with Katrina Kazda, did I say that
Gotcha.
right?
Gotcha.
Kazda, VP of Home Care Innovations for the ICA Group. And so let's see. What do you think about? Well, I wanted to talk about Elevate, of course, because that's your baby right now, right? So let's talk a little bit about Elevate, the inspiration for that, and maybe some of the process. And then we have a couple more questions before we close out.
Great. Sounds good. Yeah. I do love to talk about Elevate. It is my baby, which we will birth soon. So Elevate Cooperative is a new national secondary cooperative for the home care cooperative space. The idea for it really came about in 2018. We were commissioned by the Cooperative Development Foundation with funds from USDA at that time, the Rural Cooperative Development Grant Program, to really look at and answer the question of how the cooperative model, and worker ownership in particular, could be leveraged to solve the national caregiver shortage crisis. So if you're not in home care like I am, you may not know that there's a shortage of caregivers, and a really significant one. And because of the aging of the baby boomer population, there's incredible demand for home-based care services. And home care is care for seniors and people with disabilities at home, and of activities of daily living, bathing, washing, grooming, light housekeeping, also just companionship, things like that, services that individuals need to be able to live safely and comfortably in their homes and in their communities, as opposed to moving to an assisted living facility, nursing home, etc. So it's kind of like what the work is focused on. And so at that time, there was a shortage of caregivers, and the reason being because the jobs are bad. They are one of the lowest paid jobs in the economy. It's actually the fastest growing job. The number one fastest growing job in the country is care workers, direct care workers, and home care workers.
Wow.
And so you'd think, well, lots of jobs, great, lots of opportunity, but these jobs are paying, $12, $13 an hour, kind of on average.
Mm,
$16 is kind of where things sit right now. But the hours are really inconsistent. Benefits have been improving, benefits access, but overall pretty low. Over 40% of home care workers live in low income households. And the majority of home care workers are women, women of color, and immigrants. So it's not accidental that these are bad jobs. This is really, continuation of a number of systemic issues: racism and slavery, sexism, classism, etc. So all of that is layered into, the system that we have now. And so, people are not rushing to these jobs. And of course, now you can go work at Target or Amazon and make more money, and have that consistent work. But, those are not easy jobs either, nor are they necessarily as meaningful. So we conducted this study, and through that really came to the conclusion that not only do we need to scale worker ownership and just really expand the model nationally, but that in order to really be effective at transforming home care, so not just creating pockets of good jobs, but really having a meaningful impact on this system of bad jobs, we would need to create some sort of institution to really pool that financial and intellectual power and to really push for a policy change. And so, we kind of started early on, just growing the network rather, and the sector. At that time, there were, I think, about 10 cooperatives nationally, and people were really not cooperating very much. Maybe they knew about each other or had individual relationships here and there, but there wasn't really a sector, so to speak. And so our early efforts were really just focused on bringing everybody together and really creating that peer network, having regular calls, really changing the nature of the conference and getting more people to the conference so that they could connect and develop those relationships in person. And then over time, we started to do more webinars and education and cross-network sharing. And then ultimately, actually, in COVID, we were working on a business plan for Elevate at that time, and things were very bleak in the world, of course, and in home care in particular. And caregivers were having a lot of trouble, and our cooperatives were having trouble accessing affordable PPE, masks and things like that. So we took our first leap into acting as Elevate at that time, doing a group purchase of PPE, doing a bulk purchase to try and get access to more affordable PPE for the cooperatives. And then things really kind of started rolling from there. And so for the last 3 years or so, we've been really deeply involved in the development of Elevate, piloting different initiatives, really doing the research and development of, the benefits and the offerings, and thinking about governance and, what the structures will be there. The goal in the not too distant future will be for Elevate to be a secondary cooperative that is owned by its membership. Right now, it's really a project of the ICA Group in partnership with the network and the cooperatives, and very much informed by their needs and input. So all the way back to 2018, when we started the study, we were building Elevate based on the needs of the network. So having focus groups, doing needs assessments, one-on-one interviews, really engaging deeply with all of the cooperatives to understand, what were the pain points? Where were they really succeeding? Where were they struggling? Where was there overlap? Looking kind of at that national level. Something we launched, I believe this was in 2019, also was a national benchmarking study. So really collecting key metrics, data from across the sector nationally, again, to really be able to see where things kind of in a positive upward trajectory, where are we continuing to see struggle, where is there commonality of struggle across the cooperatives. And that was another kind of key informing piece of what ultimately would become Elevate. And so we're just kind of now at the cusp. We've been piloting, as I said, a lot of different things over the last couple of years. In 2024, March 2024, we actually launched a national online platform to facilitate ongoing peer exchange throughout the year, and kind of resource sharing and all of that outside of the conference, because we were always getting together for 3 days, having a beautiful exchange, supporting each other, saying we should do this more, and then going home.
Yeah.
I'm sort of living in our siloed worlds, and co-ops were struggling and feeling alone. And so we really wanted to launch this kind of online platform to try and facilitate that support and exchange throughout the year. So we did launch that in 2024, and that's been really active. And now we're gearing up for the launch of a formal membership program at the end of this year and start of next year. And we won't yet be operating as a cooperative in the beginning because we're really focused on fundraising to be support the development and rollout of all of the different solutions that we know that cooperatives need, but just cannot possibly afford. So we need to support that. Once we roll it out, then the membership can support that kind of on an ongoing basis. But there'll be marketing support, coaching, education and training, peer networking and exchange, access to lines of credit and different financial products that are really tailored for home care cooperatives and very friendly to the home care cooperative space, access to grants, kind of on and on, group purchasing, discounted insurance, and other kind of software services and products. So we're really excited about it. And the cooperatives are excited. Of course, it's always, well, what are we going to have to pay and can we afford it? But the network is really, really engaged. And we're really committed to figuring out how we can make this work. It's just so beautiful when the cooperatives come together. So yeah, I think there's a ton of potential.
That is amazing. My goodness. I have like 10 questions, but I know we only have 10 minutes. So I was going to ask about insurance and technology too. Talked a little about it, about technology, but I did want to ask also just sort of with that research, the research and development, the studies, all the other things that really helped. You had to gather all that information to really know how to move and what to do, for the group. And so, I know we've done info sessions, just initial info sessions. That's always at the start, like needs assessment, like you do that at the beginning, right? But you have to go a little bit deeper. I'm just thinking about the broader landscape and maybe what you're thinking in terms of, the shared services model or the secondary model, as you call it, and all the broader ecosystems, and what would be some of the sectors that we really should be focusing on now. For example, we were going to do, we are going to the National Association for Housing Cooperatives Conference. GCDC will be there. And Fred Gibbs, who is the president of that, was talking about, I would love for you all to be there, just so you can talk about the correlation between shared services and housing cooperatives, because we see how there's so just sort of like with that lens and with your study lens and the research lens, what do you think are some other sectors or industries that cooperatives should be focusing on next, and how they can sort of work together? That makes sense.
Yeah, gosh, what a great question. This is something that ICA is specifically investing in this year, actually, as part of our plan, to really examine what are other sectors that could really benefit from secondary models and the creation of networks. Childcare definitely is one of them. We already did start a small network based in Chicago, where there's a lot of opportunity for growth for family childcare providers. I do think any low wage sector, and service sectors in general, any place where there's really low margins, there's a huge opportunity to pool, because they're just, otherwise there's no resources to kind of make the job quality improvements with. You do have to pool. So I think that there's a lot of opportunity in the service sectors, for sure. And any place also where there's a lot of purchasing. So this is a place where, say, home care is completely different than food co-ops, right? In food co-ops, there was such a natural opportunity because there's efficiencies of scale and you can negotiate better rates, and you're buying like really, large quantities of food. So anywhere where there's large quantities of buying, where you would have more buying power as a group, kind of natural opportunity, right? Or where there's a lot of repetitive systems and processes that can be, again, pooled and, both more cheaply but more efficiently processed. So, for example, one that we're working on now is a composting secondary cooperative and shared services. And I want to take a little foray onto shared services and secondary cooperatives in a minute. But, where every community maybe has a different cooperative, there are going to be some differences, but everyone's basically doing a similar thing, right? They're going and they're picking up, recycling, trash, composting, they're invoicing their customers, they're collecting payments and paying their workers, right? In that are absolutely a lot of opportunities for group purchasing, group processing, et cetera, and kind of negotiating better rates with vendors. So I think a ton of opportunities there. And so it's those kind of two places where there's like big bulk purchasing or really, kind of repetitive common systems, processes, or low wage industries where you just need that scale to be able to purchase, at lower rates and kind of like bring costs down. So, it's a broad answer to your question, not specific, but I think there are very few sectors probably that couldn't benefit
Yeah.
in some way, right?
Yes, absolutely, absolutely. That makes sense. All right, and, all right, you talked about the composting. Are there there's a couple others, or is it just the composting that you have done shared services, cooperatives, or created those with ICA?
So for us, the ones we've created, so the Alternative Staffing Alliance was one of the first. It's kind of a little bit less of a shared services, but more of a network
Okay.
approach where there's a lot of sharing, kind of peer sharing, and definitely, some opportunities for group purchasing and negotiating better rates and things like that. And those are organizations who are supporting individuals who have barriers to employment. So it was one of the first networks that ICA created. Then kind of at the same time we started to create Elevate, we also started to create a network for family child care providers called Co-Rise
Mm,
Cooperative. And family child care providers, again, it's an area where it's very low wage, very difficult economics. It's a very hard business to make work. And care providers are both caring for children all day and then basically at night needing to do billing and purchasing and management of a crazy number of things. I would
yeah,
say most family childcare workers are, or business owners are working, 100 hours probably a week and
yeah,
not getting paid for, 60 hours of that time, right? It's very, very difficult. So huge opportunity to centralize billing, to do group purchasing, to provide support like that. Composting is the one we're looking at now. I do think renewable energy is another area. My colleagues are looking at cannabis. So I think that there's just a lot of places where there's opportunity. And I guess one thing I'm reminded that I wanted to say was, I think in thinking about secondary networks broadly, I do think shared services and secondary cooperatives are similar, but not exactly the same. So for example, Elevate at the national level is right, at least now, not focused on things like doing group billing, because we have cooperatives all around the country kind of involved in different things, and there are different state regulations and requirements and whatever. So that's kind of not what we're focused on. At that national level, and we have these larger goals of really like systems change and policy advocacy. So that's kind of like, but there's a lot that you can do within the secondary cooperative model broadly and kind of what that means. Shared services I think about more as like a shared back office, and that tends to be more regional or a little bit just kind of tighter knit. So a different example in home care, ICA is a key design partner in this organization and this network called Vivid Life Home Care. And that's a state-based secondary cooperative that is both creating and spinning off new home care cooperatives under a common brand and providing shared services. So advocacy is part of that, but because it's state-based, for example, we hired the first staff that we hired for the headquarters. is a director of business development and operations. So that individual is working to build business and do marketing and build referral partnerships across the whole state for the whole network. So it's quite localized and very hands-on. And we are looking at group purchasing of health insurance and phone systems and all of that kind of at that state-based level. So there's a lot of different layers to it, and it can be very operational, or it can be more I don't even know what the word is, but kind of like a picture, more transformational, in a sense, and somewhere on that spectrum. And it's kind of figuring out what does the group of cooperatives need? And is it more of this, or is it more of that, or is it some combination?
Yeah, there it is, that word again, the layers or the balance, right? That makes sense. That's at the core of cooperation. Gosh, we're going to have you back, and we got to do a part 2 and follow the explorations. We've been speaking with Katrina Kazda, VP of Home Care Innovations for the ICA Group. Thank you so much, Katrina, for being with us today and sharing all this amazing information. I can't wait to do part 2.
It's been a real pleasure. I appreciate the opportunity. Thank you.
That was Katrina Kazda from the ICA Group. What an inspiring look into future worker cooperatives, secondary networks, shared services, and cooperative innovation. To learn more about ICA's work, you can visit icagroup.org. That's icagroup.org. And follow our journey as we launch Athens' own shared services cooperative initiative. To follow our journey as we launch Athens' own shared services cooperative initiative, we can visit athens.coop or connect with Georgia Cooperative Development Center at georgia.coop as well. And together we do grow stronger, and we'd love for you to join us along the way. This is Aja signing off for this edition of Shared Futures on Co-op Nation Network. Take good care, be well, and we'll see you around the co-op.